Hi, I'm Dr. Robert Rubino from the Rubino OBGYN group, doing another segment of Ask Your Doctors. You can find these videos on our Facebook or YouTube channel. Today's segment is going to be about kind of a sad topic, miscarriages. And the question usually around them is, why did this happen to me and will it happen again? Well, to give perspective to all the patients out there, miscarriages, depending on the literature you look at, is about 17% of the population. So of all pregnant women, about 17% of those pregnancies will end in miscarriage. Kind of the silver lining to miscarriages is the body recognizes that this pregnancy is not healthy. And over a period of several weeks, that process of expelling the unhealthy pregnancy happens and you have a miscarriage. And a lot of women, once they have a miscarriage, want to know, will it happen again? The short answer is probably not from a statistical standpoint. If you have one miscarriage, your chances, the background risk only goes up to about 20 to 22% from the first miscarriage. And even after a third miscarriage, it only goes up to about 30% on a subsequent pregnancy. So chances still are quite good that you will have a successful pregnancy outcome on subsequent pregnancies. As far as a workup, why did it happen? Well, the most common reason by far for a miscarriage is that the number of chromosomes in the developing baby was not the right number, and that's the reason for the miscarriage. So some patients may wonder, am I going to get a workup after the first miscarriage? And again, typically it is not done. In our practice, we generally will just send for a chromosome analysis just to see, but often it is not necessary if you look at the guidelines. Even after a second miscarriage, it is not a recommended guideline to do a workup for it because the most common reason is still a chromosomal problem. We still do a little bit of an evaluation. We check the thyroid and we check for chromosomes. And after a third one, a more extensive workup is at that point suggested. Another concern is, what could I have done to save this pregnancy? And again, the short answer is there's nothing you can really do to save an early first trimester pregnancy. Whatever's going to happen will happen. There are no medicines we can give to save it. There is no surgeries we can do to fix it. Now, and that's provided after a workup, we don't find any uncommon uterine abnormality or structural abnormality, which often would be picked up from a simple ultrasound anyway that you do at the time of presentation. So, in summary, miscarriages are a part of the reproductive process. They're common, and often they're non-recurrent. So and also, if there's any of you out there who feel a little guilty about what I could have done different, there was nothing you could have done differently. So take solace in the fact that the odds are still on your side. And if you have further questions or family history, please come in and see us. We'd be happy to talk to you about it. Any women age 40 and over who need a checkup, please call our West Orange office where you can get both your checkup and your mammogram at the same visit. I'm Dr. Robert Rubino for Ask Your Doctors.